When someone dies, who pays their bills?
A Layton woman says her family is being hounded over a medical bill for her late husband, and when the hospital wouldn't leave them alone, they decided it might be time to get Gephardt.
Let's be clear here. The hospital is not coming after the deceased man's estate. No, they are coming after his widow personally, saying she now owes his bills.
Just went to bed and didn't wake up.
This past February, Jodie Elliott's husband, Larry, passed away unexpectedly. As she began settling his affairs, a bill arrived from the University of Utah, $390.85 for a trip to a dermatologist. Jodie called the U, telling them her husband was dead.
Yes, and they go, oh, well, these medical bills will now become yours, and we're going to change the bills and put them in your name.
Transfer the debt into her name?
I said, but I don't understand why I'm paying these because they're not mine. I never signed for them.
Sure enough, a couple weeks later, look, the same bills arrive, now telling her that she owes the debt. Not her husband's estate, her. Pay up or face collections. Jodie protested, but it did not do any good.
Why is that true? And she said, well, it's a Utah state law. Whenever a husband or a spouse dies, the remaining spouse is responsible for all the medical bills.
Feeling as though that's not fair, Jodie asked me to investigate.
It makes me feel scared that I'm going to lose everything I've got.
We reached out to the University of Utah Healthcare on Jodie's behalf to ask about all of this. The U pointed us to state law that says if an expense is a family expense, then it is the responsibility of both the husband and the wife. But we asked, how is a guy going to a dermatologist a family expense? To answer that question, they referred us to their lobbyist.
For whatever reason, the legislature hasn't specifically defined family expense.
Dave Castle is the executive vice president of the Utah Hospital Association.
Is a man going to the dermatologist a benefit to his family?
If it saves him from getting cancer down the road, I would argue it does.
Castle says the U is doing nothing wrong.
I think like any business, they have the right to follow this law if they'd like to.
They may have the right, but most do not.
Okay, sounds good.
Get Gephardt called the other major hospital groups in Utah, Mountain Star and Intermountain. Both companies told us they absolutely do not slap the surviving spouse with their late loved one's bills. They will go after the estate, but if the estate is tapped, the bill is written off. When I told the U they seem to be the only ones implementing the heavy-handed billing policy, they had a change of heart.
We are changing that policy.
Kathy Dellis is the Administrative Director of Revenue Cycle Support Service for University Hospital.
We are changing our policy to no longer bill patients, surviving spouses, for debt that's owing. Where instead we will bill the estate or the probate.
Dellis says the change is a direct result of our calls on Jodie's behalf. And just like that, Larry's bills are no longer Jodie's problem. The U has written them off.
So what about other surviving spouses who may have been slapped with their late loved one's bills? University of Utah Healthcare tells me they're currently auditing their system, and if they find anybody else in the same position, they will also be writing off those bills. If you have something you want me to investigate, give me a call. My number, 801-839-1250, or you can email me, Gephardt@KUTV.tv.